You're listening to On The Docket with Napoli Shkolnik.
Welcome to another episode of On the Docket with Napoli Shkolnik. I'm Maria Fleming. I'm a senior attorney here at Napoli Shkolnik. I work in the complex litigation department handling mass tort litigation, and I am excited to be here along with Soleil Carrillo.
Yes, I am Soleil, like she said, Soleil Carrillo. I am part of the medical team here at Napoli Shkolnik. I studied medicine, and that's where I come in. I try to verify the litigations, the medical aspect of the litigations. I tend to verify if the client, in effect, had an injury, for example, as a result of a drug or a product. So that's what I do here.
Very important work
Definitely.
that you do here.
And so here today, we are more than to talk about particular litigations or one case. We're here to talk about a pattern, specifically relating to women's health. And so I don't know, Maria, if you know, but actually there are medical women's health is usually under-researched, underfunded, and usually not understood. So, for example, the problems here have actually gone back way long ago. Specifically here in Puerto Rico, there are cases where in the 1950s, the first birth control medication was tested on women here.
Oh, wow.
What was sad about it was that there was it was tested without any authorization, so no medical consent. So certain populations were targeted. So poor, uneducated women were tested. They did not know the side effects, and when they would report side effects, they were dismissed as psychological. So that's a very sad part of our history. And so in the 1950s, this was part of a larger mass population control.
Right.
And it sounds made up, but you can look it up. It's true. Obviously the mistrust in medical research and in general in medications, you can see in Puerto Rican culture, for example, stems way back. And specifically in women's health, it definitely has had its effect. So,
Now, when you say that there were side effects with the birth control medication, what type of side effects were these women experiencing?
well, there was general side effects as headaches, dizziness, nausea, but there was actually even 3 deaths.
Oh, wow.
Yes, and sterilization. So it was pretty bad. Yes.
It's terrible to hear that.
Yeah. And so so talking a little bit more about litigations that we actually work with in the firm, I think a good example, for example, is Depo-Provera. We were
Yes.
talking about birth control earlier. And so that birth control that I mentioned were pills and were tested in women in Puerto Rico. So Depo-Provera is this injection that was only, you would have to put it on only every 3 months. So it's practical. It seems like it's a great solution to having to take a medication once every day. But it just so happens that a lot of times pharmaceutical companies, they throw out a product without really researching the long-term effects. And it has been linked to meningioma, which, if you think, what is that? It's actually a cancer that affects, it's either in your brain or in your spine. There's a layer in your brain, meninges. And so we have a set space in our brain and in our spine. So when you have a tumor there, although meningioma is benign, which means non-malignant, it's not officially cancer, it has really bad side effects. When that's limited space, there's a tumor there and it grows,
Right.
it pushes on the other, on the brain or the spine. And obviously the brain controls a lot of your body, your bodily functions, and your spine too. So when you have that mass effect, it can cause headaches, seizures. It can affect your auditory, vision, you name it. Basically, those nerves, they send a signal to your organs, and you can cause weakness on one side. So something that's supposed to just be easier or better, causing you a brain tumor that that creates weakness on one of your sides or is causing you seizures.
Have any studies come out to where how long the longevity of women who start with the Depo-Provera and then they develop these symptoms or signs or then are diagnosed?
So it's definitely after long-term use of Depo-Provera. Yes, the exact amount is not known because precisely. So the studies, research, and the subjects isn't well done. But yes, it's after long-term use.
Understood. And then I guess my guess would be like most of these manufacturing companies, they fail to put that as a risk on the labels.
Yes, obviously after litigations come out, we basically force them to do so. That is true. Another product that is used towards or basically a lot of the products that not necessarily say towards women, but they are in relation to your hygiene or towards your physical aspect. And although it's not directly says that it's towards women, that's basically the targeted population. For example, talc powder.
Yeah.
I mean, my grandmother still
Yes.
uses it, and I think maybe we all used it as babies.
Definitely did. I definitely use it with my son. And I know my parents use it with my siblings. So yes, talcum powder has been in use for well over 50 years.
Yeah, exactly. And so for example, talc powder, it had asbestos in it, and so it was known to cause. It has been known to cause ovarian cancer. And so something that was even, I don't know if you know, but talc powder was even in makeup. So
I didn't know that.
it was even in makeup. And so it's very important. And we were talking about symptoms being dismissed and whatnot. And I know you work specifically with certain litigations having to do with women. So
Yes.
Can you talk a little bit more about that?
Yes, so I currently work with the hair relaxer litigation. We have an MDO formed in the Northern District of Illinois. MDO means a mass multi-district litigation. The difference with a multi-district litigation, mass tort case, and a class action case is that in the MDO case, it helps to streamline the discovery process so the burden and the cost of the litigation isn't on the plaintiff. And it also allows the plaintiff to be treated individually, whereas in a class action litigation, they're all looped into like one pile per se. So for the hair relaxer litigation, like you were saying, some of these products they don't say specifically for women, but like you said, talcum powder. How many men do you know that are taking birth control, getting Depo-Provera, hair relaxers? Like these are things that women use, like you said, to enhance their beauty or to make things easier for them. So for the hair relaxer cases, we have women who have been diagnosed with either ovarian, uterine, or endometrial cancer, and they've linked the cause to the chemicals that are placed in the hair relaxer products themselves. And the issue here is just like the rest of the cases that we've talked about, the manufacturers and the defendants in these litigations have failed to put as one of the risks or warnings that could cause or could lead to those three types of cancers. So the purpose, of course, for these litigations to hold those manufacturers responsible for the misrepresentation of their product and to make sure that they're producing and having products in the market that are safe for our consumers to use. Hair relaxers is something that kind of is personal to me because I grew up wearing hair relaxer products as a kid and even as young adult. So that's one of the things that I know that is personal for me and that I have a personal connection to. And like you were saying, some women don't know when they're diagnosed, what the symptoms are. I had a client recently that I had a meeting with, and she was telling me how a doctor kind of just dismissed her because some of her symptoms were similar to what women experience when they're having their menstrual cycle. She was having, a lot of pain, cramping, or longer usual cycle than normal. And a doctor kind of just dismissed her as, well, that's just part of the menstrual cycle. Some women are different than others. And she was like, well, I know my body. I know how my menstrual cycles are. And she's well into her 50s, so she's been having them for at least 30 years. And she was just like, I'm not going to just take your word. I'm going to get another opinion. And thankfully, she did get another opinion, and she found someone who was like, well, let's explore this more, did more testing, and found out that it was a form of ovarian cancer. And so she was able to be diagnosed in the early stages. But that just goes to show that sometimes the underrepresented population are dismissed for their symptoms, and the doctors just look at it and say, well, this is just typical or something, instead of saying, well, I hear your concern, let's explore deeper. So that is a major issue in some of these women in the populations that represent the class of litigations that we are bringing forth.
I'm glad that she was able to continue and search for a second opinion. Unfortunately, that's something that happens a lot.
I agree.
And sadly, with women. And so it's important for women to know that if they know their body, and even if at the beginning they didn't listen to whatever symptoms they were saying, if you understand that what you're feeling is not common. For example, another example that we were discussing earlier is when they tell you that you're hormonal. Mm-hmm. What does hormonal mean?
Right.
I mean, there is a certain level you have a hormonal cycle, and there is certain things that are normal within that cycle, but there are certain things that aren't.
No, and like we discussed earlier, some of these women it's easier to diagnose, I guess, when you have a woman that's postmenopausal. So if they're having abnormal menstruation and they know they shouldn't be, they're like, okay, that's a red flag. I need to bring that to something isn't right. But for a lot of these women, they're still in their menopausal stage where they haven't hit menopause yet. So it's kind of hard to decipher if it's abnormal or not. And like you said, they'll just push it off as, oh, it's just hormonal, or you may be approaching the age of menopause, and that may be a factor included in that, where you may have an extended period of a menstrual cycle. So for the women that haven't hit menopause yet and they're just going through, the only way to determine that is to get some type of testing done or some type of biopsy done to make sure that that is what's really going on in their body.
Of course. And what do you think about, for example, the new GLP-1 drugs? They're not technically new. They were actually. Do you know what I'm talking about? It's the famous Ozempic, Mounjaro injections. I think we've all been tempted, if not, and if they're not using them already. So basically, this is an injection that was originally brought into the market for diabetic patients or chronic weight management, and we're talking morbid obesity. This is for people who definitely their weight is significantly impacting their health.
Yes.
And so, for example, with increased heart risks, but because of social pressures, we have certain social pressures to look a certain way.
Right.
Have our hair in a certain way. And so definitely looking skinny or being a certain amount of a certain weight has caused us to ever more look for different options, and actually, for example, injections that might not be recommended towards us. And so pharmaceutical companies have seen the benefit of this.
Right.
It is increasingly popular. And so without the appropriate, again, research in terms of the long-term effects, because I'm going to talk to you a little bit about how that works.
Mm-hmm.
It's the GLP drugs, they're agonists. And basically what they do is they increase insulin secretion and they decrease glucagon. What does that do? Basically, that delays the emptying in your stomach. So it makes you feel full.
Right.
But what else does it make you feel? It makes you feel nauseous, dizzy. If since you're not eating, sometimes you are many hours without food, and so you go into a fasting state, and you might even faint. You might have less exercise tolerance. Another side effect is you secrete insulin through your pancreas. So people get pancreatitis. What is particularly dangerous about things is when, because of a certain popularity, people have been injecting themselves. They have not done it under medical supervision, or they have not fully reviewed their medical history to see if this is actually an appropriate and a healthy option for them. And so actually recently it has also been linked to vision loss. And we're still seeing more effects. And again, we go back to the same thing. Something that is marketed because of and we fall because we have certain pressures.
Right.
And so that's what I guess is sad to me. And the story with the GLP-1 receptor agonist are still to be continued, because we're still discovering all the long-term effects of it.
Yes, it's more so of a newer class of drug, correct?
Well, I mean, it's been for a while, but it's now more popular. Everybody's using it now.
Yes.
Yeah.
Yes.
Yes,
I
definitely.
know a few people that have been taking some type of GLP-1 injections. I know I have a family member who was recommended by her doctor to take it because of her high blood pressure, and she was unable with her own exercising and doing whatever she needed to do on her own to get the weight off, to get the high blood pressure down. So she saw that the GLP-1 injections were helping with that. But then she recently had an issue with her gallbladder.
Wow, that's another side
which
effect.
could be linked to, correct.
Yes.
So it's like you said, there's the societal norm to look a certain way, and then they have so many different celebrities that are now the face of what a GLP-1 looks like. This is what your body can look like. This is what you can look like with these injections. But then they don't talk about the long-term side effects or the other issues it could lead to in other parts of your body. And then you do have some of your doctors, like you said, it's supposed to be used for diabetic reasons, but you have people taking it non-diabetic to lose the weight. And that instance, for that example, was to help with the high blood pressure, but that led to a different health issue. So
I think, so in medicine, there's a thing called risk versus benefit. And so when your physician is trying to determine what type of management to have with you, it outweighs the risk versus benefits.
Right.
Every drug is a drug, so it will have risks. And so, for example, in terms of high blood pressure, if you take a high blood pressure medication, it outweighs the risk of that medication outweighs the benefit. The benefit of that medication outweighs the risk, because it lowers your blood pressure, and in the long term, it's beneficial. I think what the problem here is when you're not able to fully assess the risk of the medication or the product that is being put in place. Another example of litigations that have been done here are transvaginal mesh. So, for example, for women who have many kids, that's an example. Your pelvic floor, basically, it grows weak. So you're gonna have usually your bladder. You have it prolapse. You have prolapse or your uterus. It depends. So you can prolapse. It prolapse when you have many children. It grows weak. So in terms to try to remedy this, transvaginal mesh was created. That basically it's like this hammock that pulls it back, right? And sounds pretty nice.
Easy.
Right, but it's a foreign product that you're putting in your body. And again, the responsibility of a manufacturer that produces a product is to know fully the extent of its effects on the human body. And so these transvaginal mesh ended up having more risks. For example, bleeding, pain during intercourse, and this mesh can actually migrate or cause perforation. So at the end, the problem that women had ended up being a way more bigger problem. Right now, what is the alternate is that they're doing surgery and fixing the problem without the use of mesh.
Okay.
So I think that's the issue. Because of a benefit to the manufacturer,
Right.
putting people's health at risk, that's something that should not be accepted.
I definitely agree. When it comes to, what is your opinion when it comes to manufacturers introducing these new drugs into the market? How long, in your opinion, do you think it needs to be where the manufacturer has the product, they're testing it before they see side effects, before they introduce it into the market?
Well, actually, that's something that's been studied and done for a long time. For example, FDA has certain measures that require an amount of population to be tested and an amount of time. The problem is when there are certain contracts or there are certain information that is omitted from that. Especially also there were a lot of research that was funded by the same pharmaceutical companies, or there were certain risks that were recognized in studies and were ignored.
Right.
Or for how much time was talc powder in the market and before it was finally at least the asbestos part removed. So I think there are certain things that are known, and that's where the issue is mostly.
Yeah, I agree.
And so, what message would you give to women in general in terms of their health, in terms of when they think that they don't have options or they're not being listened to?
What I would say to women is you're going to always have pressures, whether it's from family, society, to look a certain way, to be a certain way. And it's easier said than done to say just be comfortable in your own skin, but that's really the truth. We can't always go out and get the latest or the most popular drug or most popular item without kind of, like you said, outweighing what's the benefit and the risk. Like, does the benefit outweigh the risk? So for women, I would say to not be so self-conscious about what is being placed out in the market. And it's kind of hard with social media everywhere. Everybody is, there's a certain look you have to be or a certain way you have to be. Be confident and comfortable in your own skin and who you are. That's number one. Number two, you know your body. So listen to your body. Listen to yourself. When you don't, you go to the doctor and you get an opinion that you don't agree with and you're like, yeah, I don't think this is right. Keep going until you find a doctor that really cares, that wants to get to the bottom and resolve whatever the issue is. Don't just stop at that first opinion and just say, oh, well, I give up. I know for some people it is hard with the cost of Medicare or the cost of healthcare, period, and not being able to have access to proper healthcare. But listen to your body. There's some, clinics that offer free, treatment for some women. Go find those resources in your communities, in your neighborhoods. Talk with people that may know better resources for you to have those access to. But just make sure that you're being aware and self-conscious of your own self so you can take better proactive measures of kind of stopping these things from happening before they occur. I know for women who had hair relaxer, that was something that was like a generational thing. Their moms did it. Their grandmothers did it. And it was because these companies were marketing, this is how beautiful or pretty you can look with your hair. And I want to say like in 21, 22, there was a recent, on Twitter, social media, there was a recent campaign going around where they were asking models from, there's a hair relaxer product called Just For Me, and it's targeted towards young African American girls or young girls of color. You see these pretty girls with this long, pretty hair on the boxes. I know when I was a kid, that's what we wanted. We want our hair to look like that. And so they were like, where are these Just For Me models at today? And a lot of them started chiming in on social media, and they were saying, we never had our hair relaxed. Those were a lie. That wasn't true. We had our hair straightened, and they just straightened it with a hair straightener, but they didn't actually put chemicals in their hair. The majority of the models who came forth said we never had that product in our hair. So you see that it's not just them putting something in the market without testing it, but they're also false advertising their products and using false measures to lure people in and get the community in. So I'll just like I said, go back to make sure we're not being consumed by what we see on social media, because everything isn't really what it seems. Do your own research. Now it's easier to research things quicker. We have, access to so much information now on the internet than our parents did, our grandparents did 40, 50 years ago. So do your own research on things. Don't be so quick to just jump on the wave of what's trending now, what's new. And like I said, listen to your body. Know when it's time to get help, get treatment, and make sure you're keeping yourself first.
Of course. So I can't agree with you more. And I see, for example, a lot of the marketing, it doesn't fully disclose all the risks. And can you please explain to everybody, what is it that we do and what's the purpose of precisely these litigations?
Absolutely. So the purpose of what we do at Napoli Shkolnik, we want to hold these manufacturers, distributors, these companies responsible for false advertising, deceptive marketing, putting things on the market without actually fully investigating and fully testing how the impacts of their products will be. So we bring these individuals, these companies to court, and the end goal, yes, of course, we want our women. Unfortunately, for some of these women who've been diagnosed with cancer, we don't have a cure to give them. So outside of the financial aspect we can give them, the long-term goal is to make sure that we're holding these companies are our manufacturers and distributors. They're being held responsible in the market for what they're putting on the market, and they're being properly regulated. So if you're going to continue to sell these products that are harmful, at least you give the consumer a heads up to say, hey, I know what this can do for you. However, these are also side effects that go along with it. There's a risk that you could get cancer. There's a risk that you can get a brain tumor for long-term use of this product. There's a risk of what can actually lead to down the road. May not know how long you're using it, but just to know that that is a possible side effect. So we're putting this on the market, but we also want to make sure that you're aware of the risk of that. So women and whoever's using these products may not know to say, hey, they're trusting the company that's putting it out there. They trust, as a consumer, we trust that these things have been properly tested. They've gone through the checks that they need to go through with the FDA. They've been properly regulated. So we're relying on their expertise before they even put it on the market, as a consumer, as a buyer of any product. So our job here during these litigations is to make sure we're holding these companies responsible to say, hey, if you're going to continue to sell these products, at least warn what the side effects are. But the ultimate goal is to make them take those products off of the market or remove those harmful chemicals that are in in those products and rebrand them to be safer for the community and for the people that they're advertising them to use. So that's really the most important part of what we do every day. We're fighting for our clients. We want them, of course, to have justice. But like I said, some of these clients, some of them have loved ones that's passed away, so we can't bring those clients back. We can't cure the disease of cancer, but what we can do is try to get them compensated as best as we can, but also for long-term use, so for generations to come, for their kids and their grandkids, that they don't have to worry about these deceptive marketing from these companies that they trusted, when they were younger, because now we have better regulations in place that results from these litigations.
And you mentioned also, we've been talking a lot about how a lot of these products are and medications have been targeted to certain populations.
Yes.
Sometimes sometimes poor or uneducated
Yes.
populations, and we're talking, or people who don't have access to the same means. And can you tell a little bit more about how these litigations actually can benefit or can actually work for people who don't necessarily have a lot of means?
Yeah, so one of the, I guess, pros of a mass tort litigation is that all the plaintiffs, litigation is costly. It costs to
Definitely.
file a complaint.
Definitely.
It costs to bring, it's costly. And like you said, most of the women that we represent, they don't have the means to just say, hey, I'm going to sue this person, I'm going to sue this company, sue that company. So the purpose of what we do with a mass tort litigation, usually there's multiple defendants. And these aren't small, tiny companies. These are big name companies who have big lawyers behind them and money behind them. So what we do, so our women don't feel inadequate, or they don't feel like, well, I can't bring this case. Yes, you can, because we have thousands of other women who are diagnosed with the same disease as you, or the same injury as you, or a similar injury as you. So we lump them all together, and we front the cost of the litigation. We take care of the filing fees and the discovery. Everything is streamlined in that mass tort. But what it makes it separate from the class action is our plaintiffs are treated as individual plaintiffs. So they're not going to be lumped in, and when there's a settlement for a class action, that's just, you get whatever dispersed. These women will be looked at individually. So they'll still have their individual voice. They'll still be heard individually on their own case, but it just streamlines the process a little bit better to make things go more and more smoothly in the litigation, and then they don't have to worry about coming up with the costs up front to be able to pursue their claims.
So they have a chance.
Yes. Yes.
To make their voice heard. So I think overall it's important to know that your health is more important. And although sadly we can't trust every manufacturer, we can trust ourselves. We can trust the symptoms that we get. And specifically for women, it is a truth that sometimes a lot of the symptoms are dismissed. But to know that there are now options that are there to help you, to try to voice that. The point of this all is not to instill fear, but the opposite. To
Yes.
understand that you also do have options and can advocate for yourself.
Thank you so much, Soleil, for joining us today with another episode of On The Docket with Napoli Shkolnik. And everyone, please don't forget to like and subscribe for more videos like this.